Hola, buenos días, buenas tardes a todos y todas. Gracias
Morning, good afternoon to all of you. Thank you for connecting and being here with us for this press briefing here on March 9th, 2022. My name is Luciana Viegas. I am Public Affairs Advisor with PAHO. We have interpretation into English, French, and Spanish, and you will be able to ask your questions by using the Q&A button. And we have also received questions via email. We appreciate those journalists who sent us their questions ahead of time. Please remember, whenever you send the questions by using the chat, do indicate your name and media outlet. Today, PAHO's director, Dr. Carissa Etienne, will be updating us on the COVID-19 situation in the region 2 years after the start of the pandemic. Together with Dr. Etienne, we have Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Health Emergencies Director, and Dr. Sylvain Aldhigieri, Incident Manager for COVID-19. We are now going to start with the director's opening remarks, and I invite the director to share her remarks. Dr. Etienne, you have the floor.
Good morning, and thanks for joining today's press briefing. Last week, COVID-19 cases declined by 26% across the Americas, with 1.1 million new infections reported. Deaths also dropped by nearly 19%, with close to 18,000 deaths recorded in the past week. However, possible reductions in testing may not accurately reflect the actual number of reported cases in countries. There are still some countries and territories reporting increased associated with the latest COVID-19 surge. In the Caribbean, for example, cases rose slightly by 2.2%. Countries and territories in the region that reported increases in deaths over the previous week include Bolivia and Puerto Rico. This week marks a somber occasion. It has been 2 years since the beginning of the COVID-19 pandemic, just before COVID transmission became widespread in our region. And since then, we have lost at least 6 million people around the world to this virus. And the Americas have been disproportionately impacted, with more than 2.6 million lives lost, and we reported the most COVID deaths out of any other region in the world. Nearly half of all global deaths were in the Americas, even though our region is home to fewer than 13% of people around the world. This is a tragedy of enormous proportions, and its effects will be felt for years to come. Beyond the lives we've lost, the pandemic has had devastating impacts on the long-term health of our people. Over 148 million people in our region have been ill with this virus. And early studies show that some COVID survivors will suffer lifelong consequences. A recent WHO report shows staggering numbers on the mental health impact. Rates of depression and anxiety shot up by some 25% around the world, heavily impacted women and young people. And as health systems were overwhelmed by COVID-19 surges, countries in the Americas reported more disruptions to essential health services than other global regions. The pandemic is still a threat today. In the first 2 months of 2022 alone, 63% of new global cases have been reported in the Americas. Countries like Brazil, the United States, and Chile hit record high numbers of new infections during the Omicron surge. And we lost more than 220,000 lives across the region in this short time. We all want the pandemic to be over, but optimism alone cannot control the virus. It is too soon to lower our guard. Public health measures are being left behind in many parts of our region. Some, but not all countries, are making that decision based on risk assessments and health data. Omicron is still around, and this pandemic is unpredictable. We must build on lessons from the past 2 years to prepare for quick action if a new variant emerges or outbreaks happen among those who remain vulnerable. Yes, we can acknowledge some gains in our fight against this virus. When we started, we didn't know much about COVID-19. But now we have safe vaccines that protect us from the most severe disease and are saving countless lives. Healthcare workers now know the best kind of care to provide to COVID patients, and we have better treatment options. And we know that masking, physical distancing, and other public health measures work well to slow the spread of the virus. COVID-19 is likely to be here to stay. We must learn to live with this virus and quickly adapt to new changes. We can do that by keeping our finger on the pulse of the pandemic and adjusting public health guidance anytime there is a risk of increased transmission. Surveillance is our eyes and ears, so countries should continue to sequence the virus to monitor for variants and changes in transmission. Testing should be readily available even when transmission is low, and data should be reported quickly to inform policy making. We must also be prepared to tighten our public health guidance if the cases go back up. When places relax measures at the wrong moment, transmission spikes dangerously and we lose more lives. So when countries decide to shift their responses based on COVID trends, it is important to communicate these changes clearly so people understand and comply with the updated policies. And finally, we cannot and must not leave anyone behind. We've seen existing inequities exacerbated by COVID-19 and new inequities emerge, including in vaccine access. In Latin America and the Caribbean, about 248 million people have yet to receive their first dose of the vaccine. And these gaps are concentrated in harder to reach rural areas or underserved areas. Only 14 countries achieved coverage of 70% of their populations with completed vaccine schedules. As we plan for future phases of the pandemic, we must remember that COVID-19 is still a real threat that places a greater burden on the poor and the most vulnerable. Our wins against COVID-19 show us what is possible when we work together and when we use the tools that we know are effective. They also highlight where there are still gaps and where we can do things better. These lessons are key to improving our COVID response and tackling other health and development challenges to build a healthier, stronger, more resilient region together. Over.
Thank you very much, Dr. Etienne. We start with a question about the situation at the moment in Europe. Agustin Carosio from Full Noticia, Argentina asks, what is the impact of the war between Ukraine and Russia on the COVID-19 pandemic? We start with this question for the director, please. Dr. Etienne.
So let me thank you for that question. We are in touch with our counterparts in WHO, and in particular, our counterpart in the WHO Regional Office for Europe, Dr. Hans Kluge. And he tells us that in Ukraine, the health system is under severe pressure. And beyond its borders, he sees the fastest growing refugee crisis in Europe for more than 75 years. Ukraine has maintained its COVID-19 surveillance and response systems, and 731 COVID-19 deaths were reported to WHO from Ukraine last week. Of course, we know that this number will likely rise with the situation, and as oxygen shortages continue, and older people will be disproportionately affected as their access to healthcare is disrupted. Also, only a third of those over 60 years old are fully protected with a complete vaccine series, and that further complicates the situation. More than 1.7 million people, almost women and children, and that number is increasing daily, have left Ukraine since the 24th of February. We need to ensure that neighboring countries have the infrastructure and the expertise in place to meet the urgent health needs of those arriving. WHO is working to get the health supplies that are needed into Ukraine and to ensure a sustainable system of safe passage for the delivery of humanitarian health supplies to where they are needed. This is something that we do in every conflict. Expert WHO teams have been deployed to Hungary, Poland, Moldova, and Romania, working with UNHCR, with governments and partners to assess the needs of incoming refugees, to build the health system capacity to accommodate refugees, and to ensure access to services. Life-saving essential medicines such as oxygen and insulin, personal protective equipment, surgical supplies, anesthetics, and safe blood products are in short supply. So far, 2 shipments totaling 76 tons of trauma and emergency health supplies are in transit in Ukraine. Oxygen concentrators and more supplies are also on their way. WHO is committed, and the WHO Europe WHO office in Europe, supported by WHO headquarters, are committed to work in delivering humanitarian services and ensuring that whoever is left in Ukraine and those who are refugees receive health care that is appropriate for their needs. Thank you.
Thank you very much, Director, for this update on the WHO response. Seguimos entonces con una pregunta.
We now move on to a question from Argentina. Amelia Bexer, a journalist with Clarín, has 2 questions. The first one also in connection with the situation in Europe. Emilia is asking in this context, war context, what will happen finally with the approval of the Sputnik vaccine? Where is the review? Russia guaranteed that to the WHO that they would continue to produce the second component of the vaccine. Dr. Barbosa, thank you. Thank you very much for these questions. Undoubtedly, there are several doubts in connection with the impact of the war on vaccine production. Let me clarify the questions one by one. First of all, the pre-qualification process or authorization for emergency use for the Sputnik vaccine continues. It's still open. There is no conclusion yet, and there is no date established to complete that process. In general, this may take time since WHO needs more information, and also they need to establish a dialogue with the producer. We do not have any information on the impact that the war may have because inspections in Russia may not take place at this point in time. And there is no vaccine that is produced in Ukraine or Russia that is authorized for emergency use and that may be acquired through the COVAX facility or PAHO's revolving fund. So all of the vaccines that are provided by PAHO's revolving fund do not have any issues because there is no production of vaccines or syringes in any of those countries that supplied to us. So we continue to monitor the situation because there could be problems with shipments. So we have direct contact with those who are transporting the vaccines in the region, but so far we do not have any difficulties to have the vaccines reach the region. As to the question whether it is possible to have new waves of transmission, it is quite likely because there could be a new variant, and for that we have no prevention. But all of the effort that Argentina is making to vaccinate the population, as we know, they have reached already to 40% of the population with the third dose. That could prevent the negative impact of a new wave in case of severe cases, hospitalizations, and deaths. So it is highly important to continue to vaccinate so that everyone can complete vaccination with the second dose, and also for those who have the indication to have the third dose to be properly protected. Thank you. Thank you, Dr. Barbosa. We now move on to a question by Contrapunto. Vanessa Davis is asking, countries such as Colombia stop demanding the wearing masks in open spaces. Is Venezuela in a situation to implement a similar measure and also to relax other measures such as physical distancing? Dr. Ugarte. Thank you, Luciana. Thank you, Vanessa, for that question that also applies to other countries. And in the case of Venezuela, even though the reduction in the number of cases, of new cases, continues in Venezuela, it is still considered advisable to follow that trend in the states and nationally to maintain protection measures, including wearing masks and physical distancing. Those continue to be precautionary measures. So we do understand that the national authorities still maintain those measures, and that at the same time they are controlling the situation and they are aware of the global recommendations and regional recommendations by WHO and PAHO to implement the measures and steps that they consider proper at the national and subnational levels. We think that that type of analysis, a risk analysis of the transmission level and also the availability of health services in others, such as the early diagnosis of symptomatic cases and the follow-up of suspected cases, are very important to relax measures and also to maintain the conditions in the health services, as we have seen, not only for COVID patients, but also for individuals seeking attention, healthcare, and public health services. Thank you. Thank you, Dr. Ugarte. We have another question from Venezuela, Luciana Solano from Voz de America in Caracas. It's asking what is the latest information that we have on cases and vaccination in connection with COVID-19 in Venezuela, and also given the context in the country, what can we expect for the remainder of 2022? Do you have any specific recommendation for the Venezuelan population? Dr. Ugarte. Thank you, Luciana, and thank you, Luisana. The first part of the question in connection with the cases and what we can expect and also the recommendations is something that I can answer, and I will ask Dr. Jarbas Barbosa to address vaccination. Venezuela has reported 517,064 cases and 5,652 deaths from the beginning of the pandemic. And the capital sector city and Miranda state represent 30% of the cases, followed by other states at lower levels. What can we expect as of 2022? As long as the protection measures are maintained, as we previously mentioned, and as long as there are no other variants of concern, and also with an improvement of the vaccination coverages, we expect to continue to have a decreasing number of deaths and cases. PAHO, through the team in Venezuela, and the regional team will continue to provide support to the country to control the pandemic. So within this context, we recommend Venezuelans who have some sort of symptoms related to COVID-19 to look for care in the health services, to establish contact with health professionals, and also to be able to go to, for those who are unvaccinated, to go to those places that are administering vaccination. It is important to continue to work with vaccination authorities and health authorities in the countries, because in Venezuela, they do know what the situation is. They are monitoring closely and better than any other institution what the trend is and what the situation is for the health services. So maintaining public healthcare measures and following the recommendation by public health authorities continues to be very important and also a collective responsibility. Jarbas, thank you, Ciro. Thank you, Luciana, for the question. Vaccination in Venezuela has made great progress. Through the COVAX facility, Venezuela received more than 2 million doses, and we already have planning for another 6.5 million doses that will be delivered to the country in March and April. We are already in contact with the shippers as well as the Ministry of Health to report in short information on the flights carrying the 6.5 million doses. Venezuela is also reaching 75% of vaccination coverage with 1 dose, and almost 50% of the population has received 2 doses. But care should be taken here because the percentage is reported not based on the total full population, rather the population that may be vaccinated. Some countries may be reporting on vaccination rates among the population that is older than 2, older than 6 years of age. But to compare with the other countries, we're always reporting for the total population that you may also find on the organization's dashboard for whoever would like to see that information. Thank you very much. Thank you, Dr. Barbosa, Dr. Ugarte. Now we move on to a question from Mexico. Javier Hernandez Garcia from Telesur has to ask 2 questions. The first one is, what is PAHO's position regarding resuming daily activities in the case of an individual who had COVID, since the days of rest change based on the country? Dr. Aldhigieri, thank you very much for the first question. We have 2 situations. The first one has to do with a person that is recovering from an acute infection, and the second situation, the person that is developing a post-COVID situation. After an isolation period that has been established by national standards, the ability to go back to daily activities depends on the respiratory condition and also the various characteristics of the disease and other complications, which unfortunately are many, as we have described over the last 2 years, several complications in the acute stage. But resuming the daily activities has to be decided by the health professionals based on an evaluation of each patient. If the patient develops a condition after the acute COVID-19 stage, and that may have a whole constellation of symptoms long term, it is impossible to say how long that condition will endure. Those symptoms may last after the initial infection or may develop after the recovery from the acute phase. So this has to do with the complexity of managing that stage. Even though individuals who develop COVID-19 recover, or most individuals who develop COVID-19 recover completely, some individuals develop a variety of effects in the mid and long term, such as fatigue, difficulty breathing, and also some cognitive impairment. And I had mentioned this before, impairments such as confusion, lack of concentration, forgetfulness. So once again, in new cases that may be right after the acute phase or in the condition of a post-COVID situation in the long term, in both cases, the decision by the doctor is individual, focused on the individual to have the individual come back to normal life gradually. I hope I have reflected clearly on the context of the situation. Thank you very much. The second question by Javier is regarding testing. What evidence do you have about false negative results in antigen testing? Well, in connection with that question is a little bit recurring in connection with antigen detection. It is always important to mention that the mutations of Omicron focus mainly on the gene of the viral spike protein. So the spike protein. So the antigen tests that are recommended and included in the list for emergency use drafted by WHO have been developed based on a different protein, different from the S protein, and it is the N protein based on nuclear capsid, which is usually more observed. So that means that it is not usually linked to drastic mutations. Therefore, there is no evidence so far to infer that the susceptibility or the specificity of the rapid antigen tests has changed, and we recommend to maintain the routine use of those assays based on protocols implemented internationally. However, it is always important and necessary to bear in mind that the quality of all of the tests available commercially is not necessarily the same. For that reason, PAHO only recommends using assays that are technically validated in an independent fashion at a reference lab or at a collaborating center of PAHO. I hope I have addressed that second question. Thank you.
Thank you, Dr. Aldhigieri. Now we have questions from journalists from the Caribbean.
Health editor at Observer Media in Antigua and Barbuda. Karim, I will give you the floor if you can hear me.
Yes, I can. Thank you so much for having me. Are you hearing me well?
Yes, go ahead, please. Thank you.
Great. The government of Antigua and Barbuda is discussing at present a possible relaxation of the country's mask mandate, at least for public spaces in the first instance, among other protocol relaxations being proposed at this time. Considering our present epidemiological status, is this the right move for Antigua and Barbuda at this moment? And has PAHO been engaged concerning this matter by health officials here?
Thank you very much, Kadim. I pass this question to Dr. Ugarte, please.
Kadim, thank you, Luciana. Yes, the government has made decisions to adjust some of the public health and social measures in Antigua and Barbuda. PAHO's guidance and documents on adjustments of public health and social measures, when and how to make those changes, including the use of masks in the community, are still highly relevant and may provide a very good reference support to member states' decisions. And this is the type of advice that we have been given to all our member states. Unfortunately, most of them have been following those indications, also the recommendation of their own emergency committees or advisory committees. So wearing masks should be as part, as we said, as a comprehensive do-it-all approach, including hand hygiene, avoiding the 3 C's, avoiding crowded places, avoiding a confined space, poor ventilated spaces, but also avoiding close contact with other persons when there is high levels of transmission. And particularly because we know that even asymptomatic persons or patients may transmit the disease. We also need to continue aiming at for at least 70% of the vaccination coverage by the end of June. So depending on that, also on the type of protection, the type of mask worn, and where masks can be used for either protection of healthy person or to prevent onward transmission or both, those are the type of aspects that need to be analyzed internally in each of the countries. So in that regards, we are continuously interacting with the governments, with the health authorities to adjust those measures. And of course, in all cases, it is the prerogative for the national authorities considering this, the health situation, but also other aspects of the economy, social aspects, and others, to make the proper decisions, always safeguarding the health and well-being of the population. Thank you.
Thank you, Dr. Ugarte. We go to another question from the Caribbean. Royston Jones from Eyewitness News in the Bahamas asks about vaccinations. His question, there are large gaps in vaccine coverage among those under the age of 12 in the Bahamas and the region due to unavailability and access of pediatric vaccines. Is there a timeline for when the region could access these vaccines? Dr. Barbosa.
Thank you, Luciana, and thank you, Royston. Royston, I think that the main priority now, not only in the Bahamas, but in all Caribbean countries, in all countries in the world, is to vaccinate the priority groups. The Bahamas have around 39% of immunization coverage. That it's not enough vaccination to protect all the vulnerable population. So before thinking about vaccinating children, we need to go first to the elderly, to adults that have any underlying conditions such as diabetes or hypertension or cancer or other diseases that can put them at risk to develop a severe form of COVID-19. We are working with the Ministry of Health of the Bahamas and other countries in the Caribbean, how to respond to vaccine hesitancy that unfortunately is a very important phenomenon that we have detected in that region. The Ministry of Health are concerned. We are working with them to engage not only the healthcare workers that are very important, but other leaders in the region, political, religious leaders that can provide the information that the families need to receive in order to make the right decision to protect their lives, getting vaccinated. So far, about vaccine for children, we have only one vaccine that has received the approval from WHO, that is the Pfizer vaccine. Other producers, such as Moderna, such as Sinovac and Sinopharm, are in the process to get this approval. It's important to highlight that it's not a decision made only by WHO. The producer of the vaccine needs to ask WHO this authorization, needs to provide all the information to confirm that the vaccine is safe to be used among children, and also that is a vaccine that is efficacious to protect them against severe disease. So now we have only Pfizer, but we do expect that in a couple of weeks, probably we will have more vaccines available, including to be purchased through the revolving fund of vaccines that PAHO has, and this revolving fund has been working with the countries to allow them to access vaccines for more than 40 years now. Thank you.
Thank you very much, Dr. Barbosa. We now pasamos a una pregunta desde Nicaragua.
We switch back to Spanish. Kaylin Romero from Confidencial has two questions. First one is similar to one from Gabriela Solórzano from Canal 12. First question, we are 2 years into the pandemic, so how does PAHO assess COVID-19 management in Nicaragua, and what recommendations could you give to the authorities? Dr. Ugarte, thank you. Luciana and Kaylin, thank you for your questions, and thank you, Gabriela, as well. As people know, PAHO has not been able to do an exhaustive assessment in regarding management of pandemic. The information we receive is almost exclusively through the channels of the international health regulations. But following the mandate of the organization of providing support to the countries to protect the well-being and health of their population, in this case of Nicaragua, and help in such a way that there is continuity in health services. And not only for COVID patients, of course, but other conditions and also emergency management. So we have made donations of medications, PPE, and other critical inputs. And we've also supported the establishment of standards and norms implemented by the officers of the different health facilities and following the orientations provided by the Ministry of Health of Nicaragua. We've also helped to develop a training program for the Ministry of Health officers through virtual campuses of PAHO in order to train those who will be applying or implementing policies, protection of human resources, the health personnel who are frontline for protection and also for epidemiological surveillance and also other forms of training. And we have also provided inputs for doing molecular diagnosis of the disease. We consider that the information obtained by the population has allowed them to be able to implement protection measures, and we should continue to make efforts to reduce transmission even further and continue to strengthen healthcare services and the whole healthcare system so that we can come out victorious out of this pandemic and be able to confront new threats. Thank you. Thank you very much. Kaling asked for an update of vaccine shipments. So she wants to know, when will the next shipments of vaccines arrive in Nicaragua? Dr. Barbosa, can you give us an update? Thank you both for your questions. Nicaragua has received over 5.7 million vaccines through the COVAX mechanism and through the revolving fund of PAHO. Nicaragua has also bilateral agreements, and they have received direct donations. So there are more vaccines than our numbers, than our official numbers. There will be coming donations to be delivered in Nicaragua, and we are in conversations with the Ministry of Health to see when they're going to need these vaccines. And this is important so that the country can receive vaccines that they will be able to use. As many countries, they are receiving vaccines from different sources. And so we need to coordinate to make sure that the vaccine will be used appropriately. So about 660,000 doses are being negotiated with the country. Nicaragua has already been able to vaccinate over 81% of their population with the first dose, total population, and about 60% of their total population has received the full two-dose schedule. And this has been great progress in the last few days. Thank you. Thank you, Dr. Barbosa. Now, questions from Mexico. First, live from Melina Ochoa from Uno TV. She is in Mexico City. Melina, can you hear me? If you do, over to you. Good morning. This is Melina Ochoa, reporter from Uno TV. Thanks for the opportunity. This Tuesday, the health secretary in Mexico reported that there will be 6 weeks of reductions in new cases, hospitalizations, and deaths due to COVID-19. Does PAHO have the same information? Also, we heard that the epidemic of COVID-19 in Mexico is in what is being called an inter-epidemic period. So when can we consider that a pandemic or an epidemic is at a plateau? Yes, thank you. Over to you, Dr. Aldhigieri. Yes, thank you, Ms. Ochoa. Let me try and answer both questions. Regarding the reduction of cases, yes, this is true. In the last 6 weeks, we've seen a continuous reduction in cases, in new cases due to COVID-19 in Mexico. This past week, this last week, if we compared the week ending last Saturday, March 5, and the prior week, about only 34,000 cases. In other words, so this means a 36% decrease and 679 deaths, which means that there have been 17% less deaths, and hospitalization in general beds came down 70%. So it's now 17% occupation, and ICU beds came down to 9%. In this context, 31 federal entities in Mexico have a low color green traffic light, and a few only have the yellow code, according to what the Health Secretariat has reported. Regarding the second part of your question, we've seen a continuous decrease in the number of active cases. It fell to 23,140 active cases, which means less, 41% less within a week. So this third wave due to Delta, and then the fourth wave due to Omicron. So the day with fewest active cases was December 20th last year, with 14,700 cases active. To this date, there are 23,000 active cases at present. And so we consider to be having an inter-epidemic period right now, always taking into consideration that there's a possibility that new variants of the virus can emerge. However, it is recommended not to loosen preventive measures, especially non-pharmacological measures, and the risks of the pandemic transmission is not ruled out, given the international situation and what I have just said, that there is always a possibility that new variants of the SARS-CoV-2 virus can emerge. I hope I have answered your two questions. Thank you. Yes, thank you. The other question is, we would like to know what exercises help to deal with the effects and sequelae left by the viral disease caused by COVID-19, both physically and neurologically. Well, thank you very much. I'd like to relate this answer to my prior answer. Regarding rehabilitation of patients, while most people who develop COVID-19 recover completely, some people do develop effects both in the medium and long terms, and these symptoms may persist from the initial disease, or they may emerge after recovery, and they can appear and disappear, or they may recur over time. And so the situation can be very complex for the human body, and of course for those who treat them. Exercises for recovering from COVID-19 in the recovery phase, ideally should be guided by a rehabilitation specialist, and they would depend on the symptoms that people are experiencing, because we have several symptoms, as I have said before. So these exercises can't go from exercises related to breathing and managing dyspnea to exercises to reestablish muscle strength, as well as mental exercises to help with memory, with mentation, etc. People who are developing or who have developed a post-COVID condition have described that they feel bad after exercises. There is worse fatigue after exercising. So it is important to be aware of this fact and then go back to work closely with healthcare professionals when people start doing their physical activities again, and do exercises gradually, basing them, as we call them in English. It is a strategy to help prevent shock and manage activities without aggravating the post-COVID symptoms. This gradual increase of exercising seems to help rehabilitating people who have post-COVID-19 conditions, because dyspnea is one, or breathing difficulties is one of the most salient effects of post-COVID. I hope I have answered your questions. Thank you. Thank you, Dr. Aldhigieri. Now we have a last question from Mexico by Natalia Vitela from Periódico Reforma. She asks, what percentage of pregnant women in Mexico have been immunized against COVID-19? Dr. Barbosa, maybe you have an update here. Yes, thank you for your question, Natalia. Mexico has advanced a great deal in vaccination. Over 65% of their population, total population, has received more than one dose, and they have 60%, or a little over 60%, who have received the full schedule. For pregnant women, it's important to underline that all pregnant women should get a vaccination. Vaccination is safe for pregnant women, and they may protect pregnant women and prevent them from having a severe form of COVID. Pregnant women are a risk group which has been well identified for developing severe forms of COVID. So it is important that all women have access to vaccines. If they have doubts, they should talk with the nurses, doctors, and seek all the information so that they can duly protect their lives with the vaccine. Mexico has already vaccinated 500,000 pregnant women, and they continue to make progress in vaccinating this group. Thank you very much. Thank you, Dr. Barbosa. We have a follow-up question from the Caribbean by Pavel Bailey.
Should the region expect an uptick in cases as travel increases over the summer? Dr. Ugarte, please.
Well, it is too soon to know what will happen during the summer, especially because transmission has been reduced over several weeks, and even with the concern that new variants or new transmission upsticks may happen in some of the countries, it is highly recommended that all the systems, particularly the early detection systems and the tests of all the persons who are symptomatic or contacts of confirmed cases and with symptoms are tested. And this also translates into travelers, of course. But if we have learned from previous experiences, when travel restrictions were reduced significantly, particularly in the holiday season. For example, we saw a sharp increase of cases when many countries were showing previously a low trend of new cases. So we are not still out of this pandemic. As Dr. Sylvain, Aldhigieri mentioned, Jarbas, and the director also mentioned several times, we still need to approach this pandemic with a lot of caution, but particularly to ensure that the health services are operational and the surveillance and early detection systems are in place, and the information for the population, the timely information for the population is also in a way that the population may follow and comply with those decisions. We are not yet out of this pandemic, and the season, traveling season in the summer will constitute also another opportunity for the virus to transmit from one person to another person. Although during the travel itself, we have seen that most of the travelers comply with the use of masks, for example, and other protective measures, and there have not been reports on an increase of cases in travelers per se. But the situation is, what is the transmission in the location or the country of origin and the country of destination, or even inside big countries, the state or the subnational level to another level. So we need to be cautious and strengthen our surveillance system, and we have been attentive to any development so we can control this pandemic as soon as we can. Everybody wants to go out of this pandemic, and we need to contribute to that. Thank you.
Thank you very much, Dr. Ugarte. Llegamos al final de nuestra sesión. Tenemos.
We have arrived to the end of our session. We have a final question for Dr. Etienne, our director. It's a question that has been asked by several, but we have chosen Matthias Lowe question. The question is from Argentina, Medscape in Spanish. So the WHO cannot, excuse me,
of international concern for COVID-19, such as has been the case for over the last 2 years since January 2020. How far do you see that possibility? What would be the main factors that should be taken into account to adopt such a measure? Dr. Etienne, a final question for you.
So let me thank all of those who asked this question or related question. Honestly, we would require a crystal ball to be able to answer definitively. But even though the pandemic is unpredictable, we can foresee some possibilities for the future. Of course, the best outcome would be a situation where hospitalization and deaths decline over time due to adequate implementation of social and public health measures, and of course, high vaccination coverage. So in countries that achieve high vaccination coverage with consistent levels over time, but who don't fully implement and adjust public health and social measures, we think significant increases in case rates are likely to occur periodically. On the other hand, where the implementation of social and public health measures is insufficient and vaccination coverage is low, we are likely to see high rates of community transmission continue, resulting in sustained rates of hospitalization and deaths. And of course, this is the outcome we want to avoid at all costs. As I said earlier, we have to plan to adapt to the changes in the transmission patterns of COVID-19. We really must keep up and continue to ramp up our vaccination efforts to protect people against severe diseases and death. At the same time, we need to keep up testing and surveillance. We also must tighten social and public health measures which are required. And We also need to increase the availability and access to approved treatments to help those who do get infected. I know that we are at a point in the region where we are witnessing significant declines in hospitalizations and in infections. And there is the almost we can't help but to say we need to reduce all of these public health measures. We need to go back to normal. I'm afraid that there is no going back to normal at this time, that we need to continue with some of the measures that have proven to be effective. And in particular, we need to ramp up the vaccination coverage. Many countries have yet to achieve the 70% coverage. And so that's where we must place all of our attention while remaining vigilant and ensuring that our surveillance systems pick up any increase, that our hospitals are ready. So let me thank you again for joining today's press briefing, and we'll see you the next time. Thank you very much.
Thank you very much, Director, for those final words. Colegas, llegamos ahora al final de nuestra sesión de hoy.
Thank you, colleagues. This is the end of our session today. You can find more information in our website, www.paho.org, and you can also send us your questions, mediateam@paho.org. We will continue to field your questions. Thank you for your interest. Thank you for being with us, and we will see you next time. Thank you very much.